Hello, everyone. Thank you so much for joining me today. You are listening to the premiere episode of Bioethics Explained, where I hope to get more people engaged with the topic of bioethics. Most of us listening in the US, if not all of us, are likely to be in and out of the healthcare system at various points in our lives. The issues within the field of bioethics are ones that could affect any of us or a loved one at some point in our life. By increasing education and engagement on bioethics topics, we can not only learn ways to improve the healthcare system and those it serves, but also delve into ethical issues that allow us to preserve the sanctity of life, uphold human dignity, and determine the implications that these bioethical decisions have on society as a whole. Some of the topics that I hope to address in this podcast on future episodes include surrogate decision-making, living wills, physician aid in dying, resource allocation, gene editing, end-of-life ethics, and so much more. For this first episode, I'm going to speak about an issue within the field of organ procurement and transplantation. Organ donation itself already has a whole host of ethical issues that stem from it, such as how do we allocate organs? Who should get priority for this extremely valuable, non-renewable resource? Should those who have significantly contributed to their poor health status compete equally for a needed organ? Further, when is it okay to procure organs from someone who has been proclaimed dead by brain death or by cardiopulmonary death, especially when cases of autoresuscitation have occurred? What kind of system do we implement to get more people willing to register as organ donors? You get it, there's a lot to cover. Many of these issues stem from the fact that there are simply not enough organs available to all those who need them. Every 10 minutes, someone is added to the transplant waiting list, and about 20 people die each day waiting for an organ transplant. One solution to increase the supply of usable organs that would save lives is to create a regulated market for organs. As of right now, in May 2021, you cannot sell an organ in the United States. It must be altruistically given. Those who are in favor of creating a regulated market think that altruism is simply not enough. Too many people are dying. 3D bioprinting of organs is still a ways off for mass use, and until then, creating a market further incentivizes people to donate an organ at a fair price to the seller. However, those who oppose a regulated market for organs believe that it will be all too easy for exploitation to occur, particularly for poor, disadvantaged, vulnerable communities. As I began to research this topic, I was vehemently convinced that I was against a market for organ sales. However, I attempted to approach the topic with an open mind, as I ask you to do, and I may, keyword may, have been convinced for the proposition to create a regulated market for organs. You'll have to wait until next week to find out my personal take. This week, I will present the proposition for the creation and legalization of a regulated organ market, while next week's episode will be all about the opposition. Let's get right into it. In order to fully understand the proposition of creating a regulated organ market, we need to wrap our heads around the direness of the situation surrounding the lack of supply of usable organs for transplantation. I've already mentioned that on average, 20 people die each day due to the lack of available organs. 120,000 people die each year from liver and kidney disease alone, which is more than breast cancer, prostate cancer, or Alzheimer's. As of right now, there are only about 6,000 living donations each year, despite relatively low risk for donors and despite decades of education and outreach to increase organ donations. 1,500 of those waiting for a liver or kidney transplant are children. It's easy to let numbers and statistics wash over you without fully letting them sink in. Each one of those people may be a parent, a sibling, daughter, son, friend, someone with likes, with dislikes, with hobbies, with favorite foods, someone who wishes to live. These are real people, and grasping the fact that there are about 20 of these people dying every single day of the year simply because they cannot get an organ quick enough is extremely heartbreaking. That number is simply staggering. When there are so many lives on the line, we have to consider any possible solution that would maximize good. The solution of creating an organ market that is regulated is, while possibly repugnant from initial feelings, is actually quite a good one, even with its imperfections. The basic argument in creating a regulated organ market is exactly what you would expect, that with the financial incentive for donors, the number of living donors will increase, thus increasing supply of usable organs for transplantation and saving a great number of lives. With kidney transplantation, in order to increase the supply of deceased donor organs, they have expanded the criteria for which donor kidneys could be used. These kidneys would have been previously rejected due to decreased patient and graft survival rates. Further, living donor organ donations are associated with higher patient survival. Thus, living donors are extremely valuable. But as mentioned earlier, there are very few living donations per year. Living donors grapple with the oftentimes difficult decision to become a donor. They give up immense time undergoing medical evaluations, which include a mental health examination and other various medical tests, not to mention the time for both the actual procedure and subsequent recovery. The donor then is confronted with both the physical and emotional impact of the loss of one of their organs. Yet, the donor is the only one in the process who's expected to be altruistic. The transplant surgeon, transplant coordinator, the nursing staff, and the recipient are all paid for their parts in the transplant process. The donor is the only one excluded from this. In fact, donors sometimes are in a financial deficit for their part in the process due to time taken away from work. This may seem quite unjust, yet there has been a strong reason for why the donor has consistently been excluded from monetary gain. With financial incentives, it is feared that this leads to the exploitation of the poor and vulnerable, those who are in desperate, dire situations that may feel that the only way they can possibly get by is through the sale of one of their organs. However, the issue with this is the most poor and vulnerable people are already being exploited through the sale of their organs in the black market. 1 in every 5 kidneys transplanted each year comes from the black market. The people who decide to sell their kidney often live in developing nations and make the decision to sell in order to pay off their debt. They will sell their kidney for about $5,000, in which their broker will then turn around and sell it for $150,000. Oftentimes, those who sell their kidney on the black market remain in debt years after the sale, and some fall further into poverty due to recovery time and poor health outcomes that stem from unregulated care. By creating a regulated market, safeguards can be implemented to ensure donors are compensated fairly and to ensure procedural oversight and long-term follow-up care. We can create a system in which recipients can receive a donor organ within the U.S., decreasing the need for transplant tourism and decreasing the demand in the black market. Yes, there may still be instances in which someone in the U.S. is coerced into giving an organ for monetary reasons. There needs to be safeguards against this as well to ensure that the donation of an organ is an autonomous choice, with coercion punishable by law, and do our best to make sure that there are as few as possible that would slip through the cracks. An article by Arthur Mattis also gives a really great argument against the opposing view that the poor will be exploited, which I will quote here as I don't feel as though I can summarize it quite as eloquently as Mattis put it. He says, "There is little doubt that the poor would be more likely to be paid donors. But is this exploitation if the individual makes an autonomous decision after being fully informed and receives something of value in return? We do not prevent the poor from taking jobs with risk that the rich do not take, as in miners, firefighters, police, military. And in all other areas of our society, we allow the poor to make autonomous decisions. With kidney sales, in a surprising contravention of our usual ideas about individual liberty, we prevent adults from entering freely into contracts from which both sides expect to benefit and with no obvious harm to anyone else. However, I do think the financial incentive must be high enough in which the possibility of life-impacting change could be generated. Sally Sattel is a psychiatrist and resident scholar at the American Enterprise Institute who has spoken in support of a regulated market for organs, and she had suggested the payout being $40,000. I'm not sure where she got this figure or how it was calculated, but I think $40,000 is much too low of a payout for organ donation. You may ask why. How can you determine that $40,000 is too little to generate life-impacting change? The monetary value of what would generate life-impacting change is subjective. True. In fact, in my research, I came across a story of one man who had sold an organ and received just enough to purchase a taxi with a little left over. The taxi allowed him to generate a new stream of income to support himself and his family for years to come. He felt very good about his decision, knowing he saved a life while also bettering his own simultaneously. While subjective, $40,000 is still far too little, in my opinion, for a significant loss, and kidneys specifically hold a much higher value. The average time someone waits on the kidney transplant list is about 6 years. Dialysis costs about $88,000 a year. Granted, not everyone is on dialysis the entire time they're on the wait list, but avoiding such costly care is of high value to the payer. In fact, American Transplant Foundation calculated that if 95,000 patients who are on the waiting list for a kidney were able to get a transplant, it would cost about $3 billion more initially, but after the first year, the government would save $5 billion annually. Thus, a much, much larger number than 40,000 should be calculated for kidney donors that could still be cost neutral for the payer. It is only with increased monetary incentive that I would feel those who are willing to partake in the transaction through donation were not being exploited. The payment must be aligned with the value. Another concern that comes up in the opposition of a market is the risk to the donor. However, this seems to be more of an opposition to the donation itself, not to the mixture of monetary gain and donation. Further, this opposing argument lacks in the fact that there are a large number of jobs in which risk is involved, often at statistically higher rates, and people are allowed to make the assessment and autonomous decision on whether they wish to incur that risk themselves. Informed consent is and should be required from all organ donors, with a financial incentive or not. Additionally, what we do know is that the risk to the donors is very low, with very little long-term risk and with chance of death being 1 in 4,000, which is a less than 0.1% chance. Again, this is not an adequate argument against a market anyway, as it does not distinguish between donation and sales. In conclusion, for the proposition, we must get past our initial repulsion that body parts should not be commodified. A regulated market for organs is still not perfect. Ideally, 3D bioprinting will be perfected, supplying enough organs for everyone. Ideally, every American is living a comfortable life with no need for the financial incentive that a market would provide. Yet, as Peter Singer had previously weighed in on this conversation, this is not the world we live in. He states, "We must make policies for the real world, not an ideal one." A regulated market for organs meets the needs of our reality, saving many, many lives of those praying for an organ to become available, and allowing donors to offer a life-saving gift to someone desperately in need, while giving them the opportunity to change the trajectory of their life or a loved one's life. Thank you all so much for listening. I hope you enjoyed hearing an argument towards the motion of a regulated organ market, and I hope you will join me next week to hear a compelling take opposing the regulated market for organs as well. If you enjoyed, don't forget to rate the podcast 5 stars and follow us on our YouTube, Bioethics Explained.